When I first met Carmen, her disposition, like she has such a gentle spirit, very humble, just such a teddy bear. She doesn't speak English at all, so her daughters, usually have to interpret for her.
She came to this country alone, did it alone by herself, and then had to raise 2 daughters by herself.
Her goal coming to this country was only to stay 2 years to help my grandma. And then after that, she had us and decided to stay here. And she's my hero because she never gave up on me.
The first person I met in the DeJesus family was Jeanette. She came in with irregular menstrual bleeding, painful cycles. We did her workup, ordered an ultrasound, did blood work, and we found out that she had fibroids. Subsequently, I think her mother was with her during that visit and happened to mention, that she had some bleeding as well, which would be unusual for a woman who's postmenopause. Whenever you meet a woman like that, the concerns are, is this something benign, or is this something malignant? So we got her into the clinic, in short order, just because, again, this could be something more serious than not. And unfortunately, during her evaluation, she was found to have endometrial cancer.
My main fear was, my mom has cancer. Don't know how serious it is. It's the word itself. Like, I know Dr. Abiose was trying to say, it's okay, it's ovarian cancer, this is a good cancer that you want, but at the end of the day, like, all those words you block up is except for cancer. Like, my mom has cancer. I don't know how much time I have with her.
I'm not afraid of losing what I've found.
Once we found out and having the procedure and everything, it's been hard. I know that some people that have chemo, it's a 50-50. It's scary because you think more about the 50 that your mom's not going to be there.
Para ellas me imagino que duro porque ver uno que la mamá está enferma y más que yo que mi mamá murió de cáncer también. Siento que ellas sintieron duro y para mí pues yo confía mucho en Dios y solo le pedí al Señor que me diera fuerzas y que ellas no se sintieran tan mal, pues como me sentí yo cuando me di cuenta que mi mamá tenía cáncer.
She made sure that we were good when we were little. Now I need to make sure that she's good now that she's getting older. She doesn't have anybody. She had 2 daughters and we have to be there for her. She didn't give up on us, so why would we give up on her?
Even when she got the diagnosis of cancer, I could see that she had such a peace about her. She wasn't rattled. She was very optimistic, and I think a lot of that is based on her foundation and where she's come from in life. Immigrated into a country where she didn't speak the language. She went out, and was able to care for her girls, and now they're reciprocating that to their mom and caring for her in the way that she cared for them. And I mean, that made me cry even more so than the cancer diagnosis, because I can't imagine what life was like for her and them growing up.
Prior to finding Dr. Abiose, finding OBGYN was horrible. It was horrible until I found her. We're strong believers of God, and to find someone that is not afraid to talk about God, she made me feel comfortable.
I never experienced a doctor very family oriented and she treats you like one of her own. So that was like one of the things that did shock me. So why not go with a hospital that gives you that support and gives you that family need?
Through everything, here we stand.